Hi everyone. So this is Dr. Neha, your mentor and guide for PSM on Unacademy. Today I'm going to discuss in very short the high-yield topics, the must-know topics for our NEET PG 2021 for PSM. Before that, on our Unacademy app, we've introduced a new feature, Raise a Hand feature. So if you're a Plus subscriber, you can ask the questions directly to your educators. What more do you want? Also, the prices are soon going to hike for the iconic subscription. So if you want Prep Ladder Unacademy, you can grab at a discounted rates. On the 4th of August, which is today, we've also started some of the batches, NEET PG Test and Analysis batch and an ultra fast track high yield topic revision batch. So I have tried to distribute the topic subject wise. So I'll just tell you, and very soon we will be starting the revision of all these topics by 15th of August and ending it by 30th of August. All the topics revision on Unacademy app for all you students. Okay, so let's see the first one for epidemiology. The very important thing is you have to know the classifications of all study designs. You have to know about the odds ratio, relative risk. Numericals are also asked for this. You must also know the advantage disadvantage of case control cohort. Hill's criteria बहुत ज़रूरी है, which is the most important criteria, which is the least important criteria. Bias, the different types of bias, subject bias and investigator bias. Particularly, they ask you about selection bias and they are also asking you about Hawthorne bias. So you must know that. Other than that, you must focus on confounders, and confounders are eliminated by matching and randomization. So ये दोनों आपको पढ़ने होंगे, matching and randomization. RCT, of course, we must know the basic design. Difference between ecological cross-sectional study. Cross-sectional is prevalence based on primary data. Ecological is based on secondary data. Clinical trial, the different phases. Meta-analysis में now we can expect two things. Construction of a forest plot as well as we can expect in the exams funnel plot. Okay. And evidence-based pyramid, which is the hierarchy in which the study designs are arranged. So these are the must-know topics from EPID that you must revise and go. Coming to concept of health and also descriptive epidemiology, the distribution of disease is very important where we are talking about cyclical, periodic and seasonal fluctuations. Secular trends, type of epidemics with examples बहुत must है, आ सकता है. They can give you either with the help of an image they can give you, or they could ask you, give you different examples like food poisoning is an example of, something like that. Contaminated well is an example of. Okay. Other than that, health indicators, you must study about the health indicators, guys. Okay, you have different types of health indicators. What are the mortality indicators? What are the morbidity indicators? Morbidity indicators may please revise incidence and prevalence from the tools of epidemiology. Very important. You can get calculations also for the same incidence and prevalence. ठीक है, आपको calculations पे आ सकता है. Mortality indicators, calculation of infant mortality, neonatal mortality rate, maternal mortality, anything can come. Levels of prevention is a must know topic. Okay, you must study levels of prevention. Different examples can be given to you. Identify this as a primordial, primary, secondary or tertiary. Then the difference between control, elimination, eradication can turn up as an MCQ. Again, very important. What are the diseases targeted for elimination in India? What are the diseases targeted for eradication worldwide? What diseases have already been eradicated? Things like this. Little information on ICD 11 आपको पता होना चाहिए. कितने chapters हैं उसमें? All right, like we have 26 chapters now. What is chapter and anything additional that is there? Iceberg phenomenon, diseases that do not follow this. Okay, diseases that do not follow iceberg phenomenon, you must study that. Also the difference between comparison of PQLI, HDI and maybe multidimensional poverty index. HDI के लिए current ranking is very important. ठीक है? All right. Other than that, from the chapter of screening, the basic definitions of sensitivity, specificity and predictive values you must know. You must know the definitions of them and the interpretation. This is important. Definition with interpretations of sensitivity, specificity and predictive values आपको पता होना चाहिए. Also, the difference between accuracy, validity, and precision reliability with the help of an image. Name of some common screening tests, like for breast cancer, if you have to screen a woman who is young and more than 40 years, what do you want to, which test you're going to use? Relationship of prevalence with predictive value, very, very important. Like if prevalence increases, then what is happening? The positive predictive value increases. If prevalence increases, negative predictive value decreases, because twice it has come in AIMS also, the INICT, this one 2021 also, and it also came this time in FMG. फिर ROC curve बहुत ज़्यादा important नहीं है. This was more important for INICT, but considering the current pattern, like it has become 200 questions, you might get ROC curve. And एक बार Kaplan-Meier survival का ग्राफ देख लेना है. Kaplan-Meier survival analysis का एक diagram है, वो भी देखना है. Coming to vaccines, the types of vaccine, the classification, is it live, killed, what it is, okay, that you must know. Contraindications of vaccines पता होने चाहिए. Adverse event, all these are PSM pearls. Immunization schedule में some of the important vaccines, their dose, their route, very very important. Dose कैसे जाएगा, route of administration, and schedule. Okay, you must know this. I've taught you in an easier way also on the Unacademy app. You can refer to that video. Also, we'll be taking it up in the revision classes. Vaccine vial monitor, very important still. Strains, again, like types of vaccines, contraindication, adverse event, and vaccine strains, ये सब equally important है. एक question आ ही सकता है. Cold chain, what are the different levels at which and how the vaccines are being maintained, कि यहाँ पे 1 month के लिए हो सकता है, एंड वैक्सीन कैरियर्स, ये सब में कितने टाइम तक वैक्सीन वायबल रह सकता है. ओपन वाइल पॉलिसी इज इंपॉर्टेंट, यू कैन एक्सपेक्ट. एंड मिशन इंद्रधनुष, करंट फेज इज 3.0 now, where we are targeting an immunization coverage of 90%. So this is the first part of our PSM paper. Like it's you can expect 13 to 15 PSM questions. So इसमें से हम लोग टारगेट कर सकते हैं from all these 2 to 3. Is that okay, guys? Let's see what do we have next. Very very important slide is this, demographics. So you must know the demographic cycle, बहुत ज़रूरी है. It can come as a theory, it can come as an image based question. Population pyramid can turn up as an image. Any definition of literacy rate, sex ratio, dependency ratio, all these definitions of mortality rates, every time they are giving the calculation, IMR, MMR, NMR, PMR, perinatal mortality, stillbirth rate, the current value, and numericals. Of course, you must do that. Also, one more thing, school health is important. Okay, guidelines for school health, ये आ सकता है. ठीक है. So the different mortality rates and all that has been discussed in our previous lectures on the apps. You can definitely go through that once again. I'll be sharing the links also on Telegram channel, and in the revision classes we'll be taking these up again. Sources of health information, SRS has become a favorite. Okay, also NFHS, you can get how many rounds have been successfully completed, who is responsible for conducting this. Census, अभी latest census result तो आया नहीं, but certain questions could come. NSSO is National Sample Survey Office. Okay, so this is the largest survey organization under the statistical department. Okay, so since it was given in FMG, it might come. And birth and death registration duration. Fertility indicators, the definition and interpretation of CBR, TFR, total fertility rate, gross reproduction rate, net reproduction rate, general fertility rate, and general marital fertility rate. All these are very very important definitions with the interpretations. You must know, they have continuously asked this. Other than that, when you come to nutrition, looking at the INICT paper this time, you have to know RDA of important vitamins, minerals. All right, I have shared a PSM Pearl and a short video on that also. The guideline for reference man and woman. Vitamins में important है AB deficiency, वो देख लेना है. ठीक है. Certain nutritional programs में basically you must know ICDS, midday meal, पोषण अभियान, अनीमिया मुक्त भारत. ठीक है. ये सारे programs किसके अंडर आते हैं? Whenever you do do any program, you must know its ministry. Again, there's a small video on ministries which is in my YouTube channel, Dr. Neha's Community Medicine. You can definitely go through that. Iodine पढ़ लेना, या very important, the iodine requirement. Also, one thing I forgot to write, fluorine. Okay, fluorine में fluorosis याद रखना. All right, fluorosis याद रखना, and dental caries along with the images. I'll try to put out the important images also very soon for you to revise. Then coming to environment, chlorination is the heart and soul. You must know about chlorine demand. Okay, all these terms, what is superchlorination, what is chlorine demand. You must know the instruments. You must know free chlorine and residual chlorine. ठीक है, कैसे estimate होता है, what are the colors that are happening, what is the formula for chlorine demand, which is N into 2 grams of bleaching powder will disinfect 455 liters of water, जिसमें N is the first cup, which shows a color change. Other than that, water related diseases, the classification of that you must know. Air pollution indicators बहुत important है, which is the most important one. What are primary air pollutants, what are secondary air pollutants, instruments for air humidity, healthful housing के guidelines, overcrowding किसको बोलते हैं, guidelines of drinking water, waste disposal का technique, all right, which is the most good one, sanitary landfill control tipping, all those. Difference between sewage sludge, entomology vectors में guys, all the 4 types of mosquito, hard tick, soft tick important है, louse, rat flea, reduit bug. Okay, and vector control, of course, a little bit about malathion, a little bit about DDT is very, very important. Next, come to family planning and contraceptives. Any new scheme and initiative, like what is the incentive provided to Asha for delivering a contraceptive at home, all those things. OCP IUDs ka contraindications, advantage, disadvantage, the identification features in the form of images can turn up. Failure rate, very important. What are the newer contraceptives? So you must study, revise about Antra. You must revise about Chaya and Go. And one more thing, Pearl Index. Also look at what is the difference between Pearl Index and life table analysis. They are measures of contraceptive efficacy. So most important is life table analysis. Some of the acts that I have written, Mental Health Act, pretty important. Okay, what are the changes according to that? MTP Act, the newer change. COPRA and POXO Act, कम chance है. More important is Mental Health Act and MTP Act. Okay, we've discussed that also. Coming to biostats, of course, you can see 1 to 2 questions expect from biostats. The types of data, the classification of variables, important, central tendency, mean, median, mode. We have to see how they are calculated and some simple questions about that. Standard deviation and standard errors आपको आनी चाहिए. Difference between normal versus skewed distribution is important. Okay, the image is very, very important. Confidence interval for mean and confidence interval for proportion. The formula, ठीक है, formula for calculation is important. Parametric, non-parametric test, please expect an MCQ out of this. All the following are parametric, except all the following are non-parametric, or they'll give you a situation and you have to apply a test. Graphical representation of images, very important. Sorry. Yes, graphical representation में mostly the one that they give you is histogram, bar diagram and scatter. ठीक है, box and whisker plot basically INI-CT के लिए important था, but identification of course you must see how to identify it. ठीक है, sampling में pay attention to simple, systematic and stratified and cluster and the names of the non-random samplings. Type of errors तो आएगा ही. What is type 1 error and what is type 2 error, the general definitions of it, which is more serious, which is an indicative of false positive trial, कौन सा false negative trial है. ठीक है, so इस पूरे में से तुम expect कर सकते हो 2 से 3 question आराम से. ठीक है, coming to the programs guys, most important National Tuberculosis Elimination Program with the logo, the categories, incentives, the newer initiatives that have been taken up. All right, shorter MDR regimen, okay, all those things, newer definitions. Vector-borne disease control program में malaria is important, where you must revise chemoprophylaxis, okay, ये आ सकता है. Kala azar and filariasis we are targeting to eliminate, okay, so you must know the elimination criteria for them. ठीक है, काला आजार में वेक्टर, सैंडफ्लाई, क्यूलेक्स एंड फाइलेरियासिस. All right, or yes, Japanese encephalitis. Please remember, Japanese encephalitis life cycle is pretty important. Other things that you can see, and treatment guideline for malaria. ठीक है, ट्रीटमेंट गाइडलाइन बहुत इंपॉर्टेंट है, मलेरिया का ट्रीटमेंट गाइडलाइन. Measles, chickenpox, leprosy, polio, we must revise and go. HIV and STD, this program is a must. What are the screening tests that are being done? What is an ICTC center? What is your post-exposure prophylaxis? Very, very important. All these things, management of a person with HIV AIDS कैसे करेंगे, वो medicine का भी part है, देख लेना है. मैनेजमेंट टेबल्स फॉर रेबीज, टेटनस, डिप्थीरिया, ARI बहुत इंपॉर्टेंट है. दिस इज इंपॉर्टेंट. ओके, हाउ विल यू मैनेज अ केस ऑफ रेबीज? टेटनस का जो एक टेबल है, डिप्थीरिया एंड ARI, एनीथिंग कैन कम. Blindness and visual impairment में you could be asked the latest update in the definition of basically blindness. Okay, also indicators of obesity is very important. ठीक है, वही आता है basically NPCDCS में. You must know what are the new diseases included in NPCDCS, like we've included COPD, chronic kidney disease also now. What are we doing at sub-center level, CHC levels, district and higher above that. ठीक है, नेशनल हेल्थ मिशन का लॉन्च डेट पता होना चाहिए, लोगो पता होना चाहिए. मैटरनल हेल्थ इनिशिएटिव्स, द न्यूअर वंस, बेसिकली यू मस्ट नो अबाउट सुमन. चाइल्ड हेल्थ इनिशिएटिव्स में वेरी इंपॉर्टेंट इज होम बेस्ड न्यूबॉर्न केयर. ऑल राइट, यू मस्ट नो होम बेस्ड न्यूबॉर्न केयर एंड ऑल्सो यू मस्ट नो फैसिलिटी बेस्ड न्यूबॉर्न केयर. ये दोनों आ सकते हैं, होम बेस्ड न्यूबॉर्न एंड फैसिलिटी बेस्ड न्यूबॉर्न केयर. ठीक है, दीज आर सम ऑफ द इम्पॉर्टेंट वंस. ऑल्सो ARI में ही IMNCI आ गया, सो दैट इज प्रिटी इंपॉर्टेंट. फ्रॉम हियर यू कैन एक्सपेक्ट अराउंड 2 to 3 क्वेश्चंस अगेन, 1 2 या 3 में से कुछ आ सकता है. Last but not the least, coming to the later part of the topics, biomedical waste management, classification and disposal, very important, which is going into which color bag, all those things. Concept of inertization पढ़ के जाना है. Health centers में you could be asked anything, sub-center, PHC, CHC, the population norm, very important. This is the workers, very, very important. This is कौन कहाँ पे है, and also you must know about urban PHCs for what population, CHCs for what population, both rural and urban areas. Please don't forget to revise आशा, बहुत ज़रूरी है आशा को revise करके जाना. ठीक है, everything about her. Primary healthcare definition, elements and principles with examples are very, very important, like community participation, give an example of that. Appropriate technology, give an example of that. Health management techniques में, these are the ones that have been repeatedly asked. Cost benefit, cost effective analysis, systems, network में critical path method and PERT along with the image. ठीक है, okay. Health planning committees, most important, board, Jungalwala, Srivastava, Chadda, Kartar Singh, Mudaliar. So I have shared a video on Unacademy YouTube where I've made this planning committees very easy for you. You can go through that. A little bit about universal health coverage with SDGs. Basically यहाँ पे आपको पता होना चाहिए आयुष्मान भारत. All right, आयुष्मान भारत is an ambitious program. We cannot ignore that. Okay. Disaster cycle is important. Okay, most common infection, what about immunization, should we give or not, all those things. Pneumoconiosis, any can come. Bagasosis, bicyanosis, simple भी आ सकता है. Lead poisoning, देखो ESI Act, Factory Act, in and out, everything, all right, has to be known to you. ठीक है, genetic counseling, prospective, retrospective, and since we are talking about genetics, we must revise euthenics and eugenics also. Okay, what is the difference between them? IQ level classification कर लेना. ठीक है, then what is the most common cause of suicide in India? What is the most common cause of abuse? Okay, like which is the most common substance which is being abused in India? You must know that also. From health communication, we must know the definitions and we must know the methods with images, guys. Okay, the communication cycle. Most important is the different didactic and Socratic methods. पैनल डिस्कशन सिंपोजियम में डिफरेंस अभी भी आता है, एफजीडी आ सकता है, डॉक्टर पेशेंट रिलेशनशिप आ सकता है, व्हाट इज द डेल्फी इज वेरी इंपॉर्टेंट, एंड द डिफरेंस बिटवीन हेल्थ एजुकेशन एंड प्रोपेगेंडा important है. International health, all the images, particularly look at WHO, UNICEF, ILO, FAO, UNDP, UNFPA भी देख लेना, नीट पीजी में आया हुआ है, along with the headquarters. ठीक है, and of course one more thing I missed over here, World Bank, that is also important. Then all the bioterrorism agent classification, biosafety levels, diseases under international surveillance and under international health regulation has to be looked after. Okay, last but not the least, you have to look at the topic of sociology. You must know all the definitions. इसमें से definition ही आता है, society, community, social pathology, culture, customs, opinion, belief, attitude. ये करके जाने. फैमिली साइकिल्स, टाइप्स ऑफ फैमिली, सोशो इकोनॉमिक स्केल्स, जिसमें मॉडिफाइड कुप्पू स्वामी स्केल पढ़ना ही पढ़ना है. ऑल राइट, 3 to 29 इज द स्कोरिंग, व्हाट ऑल इज इंक्लूडेड. अदर देन दैट, बीजी प्रसाद एंड उदय पारिक स्केल. ठीक है, सो दीज आर सम ऑफ द मोस्ट इंपॉर्टेंट चैप्टर्स. 1 to 3 will come very soon on Unacademy. I will be starting a revision plan from mostly 10th of August till 30th of August. We'll be continuing that on the Unacademy app, so you can definitely tune in. Also, very important, right now we are doing PYQs which are covering all these things, so you can join in every day at 9 a.m. on Unacademy app. They are absolutely free. Images ka session I will take on the channel, and I'll also let you know all the important images. So I think if you revise your PYQ and practice a little about new patterns, something, and revise your topics, you're good to go. Thank you so much for watching. All right, and all the very best. Keep revising, keep studying, and keep solving MCQs. Thank you.